So there is still no approved treatment for methamphetamine use disorder, or with really withdrawal at this point. There's no pharmacotherapy as well in regards to this, which leaves a big problem to this day. With meth use on the rise, still up in 2024, and we still get delayed on the numbers on what the actual numbers are in regards to methamphetamine use, or even any drug abuse for that matter, that you would think they would try to be coming up with more and more actual FDA approved treatments, which they have not yet. But what I'm going to be talking briefly about some ways to make methamphetamine withdrawal a little bit easier, and some potential off-label treatments that if you go see a psychiatrist about, or even your doctor, even if you're in the inpatient setting, talking to the doctors about in regards to making it easier. And this is for if you've, especially if you've been shooting it, or you just can't get clean and you're wanting to get clean. I make this video for educational purposes only, and also just so everyone knows, I got demonetized for some shorts for reuse stuff. My channel will be back monetized in 90 days. If you want to, you can donate via PayPal. All money goes towards just improving the channel, every single dollar. But yeah, in 90 days, I'll get to reapply for it. We'll see how that goes. But it was the shorts for reuse. But I can still put videos out and everything. It's just not monetized anymore. But yeah, let's go ahead and jump right on into it. So with methamphetamine in particular, as stated, there is no treatment that's been approved by the FDA yet. There's no medications that have been approved, which can make it extremely hard for people. And I know there are plenty of people out there who have gotten clean, but and stayed clean up to this day. But the big problem in vast majority of people today is polysubstance use, so meth, alcohol, or just uppers, downers, you name it, mixing them together, which can be tricky. But if somebody is just using methamphetamine alone, I think this is who this video in particular could really help. Because if you're just using a hardcore stimulant like that, first off, I know it's scary if you're using something like meth, but if you're just using that, or if that's the drug that is the hardest for you to just get off of in general, there is good news to that. First and foremost, going through methamphetamine withdrawal, there's nothing you need to worry about in regards to like seizures. So like serious medical emergencies. With alcohol and benzos, if you've been taking those for a long time and you don't taper off of those, unfortunately, seizures can be a result. So you should always get help if you can with that. But back to methamphetamine. With methamphetamine, the risk of seizures, it's not the same as with downers or with alcohol or with benzos. And a lot of medications in general, a lot of medications that affect your psych in general, unfortunately, there are side effects to where they'd want to taper you. But the one thing about, for example, methamphetamine is the one positive is you don't have to worry about things like that. Meaning, does make it easier in that regard to where you can, if you're going to be detoxing through it, you can ease your mind in that way. But it's still very hard with the mental cravings, obviously. And I say this from working in a psychiatric hospital as a psychiatric RN. Just the things that patients have reported to me being the hardest things when doing assessments on what they say is the hardest part of it. And it's obviously the cravings, but another big part is if you're doing this at home, if you're doing this obviously in the psych setting, if you're in an inpatient setting, you're gonna have more resources. But if you're at home, one thing I really want to encourage you, if you have this resource, and I know a lot of people don't, but if you do, try to go see your doctor, or in general, there's a study that was done actually on Vyvanse, which is technically a medication for ADHD, and sometimes it is a medication for people who can't stay awake at all. They fall asleep during the day, narcolepsy. But one thing it found was short-term use while going through the initial detox of methamphetamine, and this is through using methamphetamine primarily if you've been shooting it or you've been using it for 2+ years. They found that it made it a lot easier, and they had participants who were using methamphetamine, and keyword, by itself. They weren't using any other they weren't polysubstance users. Now, once again, sometimes people lie about that. They just go, they get clean for like a week, go into these trials. Just, they should be doing a hair test to make sure. But what it found though was, and I think this could help even if you were a polysubstance user, and this was the thing that's always been the hardest to kick. How Vyvanse works, and there aren't any studies for like amphetamine salts with this yet. And I know this is going to be a little controversial. People will be like, oh, they're the same things. Methamphetamine and amphetamine salts or Adderall are not the same thing. They're close in chemistry, but they're not the same thing. The power and the addictive, you can become addicted, obviously, to amphetamine salts. But if you actually have ADD or ADHD, it's not the same. Meaning, if you actually have ADHD, when you're going off of it, or if you go without it, you're not going to be craving it. A lot of times people have ADHD, unfortunately, with it, they don't want to take it because it makes them tired. People who have ADHD. But I go on that rant, sorry. Back to methamphetamine. With methamphetamine, if you can get something like Vyvanse, which is a prescription medication, what they found in the study with it was if they were taking it at a dose of anywhere from, it was like 40 to 70 milligrams, and remember, Vyvanse it's a capsule, it's extended release, and what it does is it helps enhance the dopamine, because when you're using methamphetamine, it affects your dopamine receptors, and when you go off of it, your dopamine balance is completely off, meaning you're going to be extremely, extremely tired, because when you're using things like meth, it's a stimulant, meaning your sympathetic nervous system is essentially constantly going. You're not getting sleep, racing heart when you have a sympathetic nerve response, pupils constricting, dilating, both, you name it, very anxious. So when you've been doing that for so long, when you quit it, you're going to feel extremely tired, no motivation to do anything. You're going to want to sleep all day for a couple of days, typically, at least, because depending on how you're using methamphetamine, there's a lot of times where you go on 4 or 5 day benders where you're not sleeping at all. Now with that, what they found with the study was taking like a Vyvanse. It's kind of like, once again, it's extended release. Adderall is instant release, but with Vyvanse the study was, but I think this could work with Adderall as well. There's no studies on this though. They did it over a 2-week period. They took Vyvanse and they tapered that dose down to the lowest dose. I think it was 10 milligrams of it over 2 weeks. And with that, they stayed on a consistent sleep schedule. Now remember what I told you, when you've been using methamphetamine, you're up all the time. So when you get off it, you crash and you're going to want to sleep for days. However, with that, your sleeping is going to get all messed up to where you should, when you're tired, go to sleep, but then you should be setting a schedule and time of consistently, while going through the withdrawal, getting up. So sleeping like 8 hours. So going to bed at like 9 or 10, getting up 6 or 7 in the morning. The first couple of days can be a little hard, but once you get past that first 72 hours in particular, and this is assuming, once again, they're not exhibiting things such as psychosis and whatnot, you go on a schedule and you're going to feel really achy. So your sleep schedule, you're going to feel bad. But if you're taking this substituted stimulant, Vyvanse, for example, it'll help. You're not going to get obviously the same feeling or pleasure from a stimulant like methamphetamine, but it'll give you just enough to even out your brain chemistry enough to where you potentially will be able to move, you'll be able to get up and get some stuff done, be a little bit more productive. It'll still be tough, but the cravings will lessen. And then the goal is you're tapering off of it, you're going through the withdrawal, and by the time you're done with the Vyvanse after the 2 weeks, the physical withdrawal is gone. Now the mental withdrawals will probably more than likely still be there. But the key is if you can get through that initial withdrawal and see that with a prescription of something like even Vyvanse, which is a stimulant, that it can be done. It found that, and I don't know how many of them relapsed after it, but it made the withdrawal so much easier going through it, having a prescription medication. And I know people right now are probably going to be saying right now, that's a narcotic. You're exchanging one thing for another. Well, let me put it to you this way. People who use heroin when they go into psych hospitals, they're prescribed things such as Suboxone or methadone, Subutex. It's the exact same principle, except it's in a controlled dose. So I think that should be an option, and people have a lot more success if they're taking things such as Suboxone to stay off of heroin. And once again, the only reason I'm endorsing this on my end is because there are so many people that are affected, hear me out on this, that are affected by not having the treatment they need. And now let's say you don't have access to treatment, you have a doctor who wouldn't prescribe this to you, there aren't enough studies, so you couldn't even get your hand, this wouldn't even be an option. The good news still is that if you're watching this video or you're a loved one watching this video, that if they are using methamphetamine, they can go through the detox with you not having to worry about seizures. And more helpful than that, if you can get through, and what I mean by this is, if you can get through the first couple weeks of it, regardless, the mental cravings will be there. Anything you've taken for a long time, you're going to have there's going to be that psychological pull to it, the post-acute withdrawal. But with time and as days go by, it will get easier. You'll find, even after the physical withdrawal and you start a post-acute withdrawal, and this is for anything in general, you're going to have harder days mentally, but every day you can get past it in one way or another. You'll feel just a little bit better. You'll feel even cleaner, if that makes sense. And also with it, you'll look back on it, and honestly, and here's the thing, and if you relapse as well, if you relapse on something like methamphetamine and you're watching this, just make today, or if that's your last time using, make this your first day clean, your first day. And I know that sounds simple, but there's AA and NA that are free as well, that you're welcome to, you can just walk into. And I know there's a lot of opinions on AA or NA, but if you have no resources at all and you've never tried it, go walk into a meeting. What have you got to lose? You've got nothing to lose. And I know, once again, it doesn't help everyone, but you should give it a try. The fact that in your mind right now, I remember talking to a patient about this, where he was like, man, I keep relapsing, I want to quit. And the first thing the doctor told him, and this is a great doctor at the hospital I worked at, he was like, well, make today your first day. Make today the first day. The fact that you're wanting to get clean and you're voluntarily in here trying to get the help you need, that's what counts. Because at the end of the day, anyone trying to help, if anyone's trying to help you get clean, but that user isn't wanting to get clean, it's a waste of time. You can support them, but you need to, at the end of the day, they've got to find their own way and have that moment. That's a little outside of what I was just talking about. But hopefully, in general, and I'm going to go through a couple of these too, if you're going through in particular, or you're thinking about quitting meth, I know that sounds weird but you know what, we're just going to talk about the awkward conversations like this, because you got to address it. I've worked in the field where people use methamphetamine, inpatient detox settings. And I'll just tell you this, if you're wanting to quit and you have a bed, you have water, you have a little bit of a support system, you can do it. It won't be easy, but there are options. And obviously, I know it can be awkward to do, but if you can, talk to your doctor. Because the more I'll tell you this is patients, if you bring this up to them, they report to the boards and whatnot, and they're aware that there's no treatments, but more people need to step up and be telling doctors that there's no FDA-approved treatments. Because that's the thing, there just aren't any yet, and the more medications they get out there like this, when I'm reading the study, which has, actually some promise, the higher chance of it being implemented and helping people stay clean. Because the one thing is, with meth being on the rise, between meth and heroin, if you ask me which one would I feel better about if I had a loved one using, and I know this sounds crazy, but if I knew somebody using, I'd rather them be using meth. Because the overdose with heroin, you don't know about the batch you're getting, you can overdose just like that. Just like that, done. And the sad thing is, people who get clean, then they relapse and they just take one little hit of it, they can overdose and you're done for. And a lot of times, with as strong as the heroin is today, The Narcan today, half the time, you've got to get multiple doses of it if that even works today. But with meth, once again, overdosing is very tough. And also with it, if you can just convince yourself to try it, just to try, you'll notice you haven't slept probably in days. And there are functional methamphetamine users, obviously. That does happen. So if you're watching this as well, this is for you. If you're like getting off of it, it's gonna hurt, but you can do it. If you have a bed, try to get some sleep. And this is to anyone too. Drink water, fluids. Don't force food in you, because if you've been using methamphetamine in particular, you probably haven't eaten a lot recently. So try to eat some. You might get some diarrhea going through the withdrawal, but try to eat some. Try to eat healthy. Try to get sleep. Stay hydrated, because a lot of times your mouth is super dry. Your teeth are just dull. So if you're wanting to get clean, just know with methamphetamine, you can do it without having to get medical supervision, although I strongly recommend it, obviously. I'm not a doctor, but it's one where, since you don't have the risk of seizures, that you can do on your own. And just know that there are resources out there and you're not being judged. There's no need for anyone to be judging anyone about having a substance abuse issue, because guess what? If a family member is judging somebody because of that, regardless of their past, you know what will happen? That'll make the user feel bad, and they'll continue to use to relieve that pain they're going through. You don't have to support them financially, but you should be there just to listen to them and help them and help provide them resources if they need it. If they burn you multiple times and whatnot with money, okay, you lay it down until they're really wanting to get help. Have them come talk to you. I know I kind of rambled on that. I just wanted to get that video out there because I know with methamphetamine today, it's on the rise as well. It's particular in small towns. It's in the cities, obviously, as well. But just know you can get clean, and there are resources. I'll link a couple other of my methamphetamine withdrawal made easy videos at the very end of the video, where I go more into what can help with the detox. But this is just things I've seen in the psych setting as an inpatient RN working on detox units. I've got a lot of videos on a lot of different medications, detox-wise, just medication, psych medication questions, just lots of medications. But this is primarily about the mental health aspect of it. So like, subscribe, comment. I know I'll be back. I'm going to keep putting out videos, but I'll be monetized again in like 90 days, hopefully. But yeah, like, subscribe, comment. I'm mad at you, YouTube, for that. That was not cool. You should have at least given me a warning. But yeah, like, subscribe, comment. Let me know what you think. I know this video was everywhere, but I wanted to put this out here because I was kind of excited. I was excited about it. So yeah, that is your daily dose of mental health. The next video, I've got a couple that'll be coming out soon. I don't know exactly yet which one I'm going to be dropping, but remember, everything pertains to mental health in some way. And there will be some jokey memes and stuff as we go through it. That's just, you gotta also laugh as well. You can't, it's serious, but you have to smile as well. Like, subscribe, comment.